Poor treatment, underpaid and overworked, that is the plight of health workers, according to a new report by Oxfam SA. The right to dignified healthcare work, a right to dignified healthcare for all, report highlights the challenges facing healthcare workers. To discuss that further, we're joined by the Treatment Action Campaign, Sibongile. Tshabalala, it's good to get you back up on the line. Hopefully the sound is a lot better. Talk us through your findings, particularly the abuse of mainly black women.
The findings is that most of healthcare workers are working under conditions that are not acceptable, and also the employment of nurses or healthcare workers under agencies, which is they are exploited. So those are the conditions that healthcare workers are working on, and in most cases they are not provided with adequate PPEs, and at the end of the day they are expected to deliver good services. In other cases they are not even resting enough, especially those who are living in nurses' homes, where even if the person has shift ended, but the person will be called to say, we have a lot of work, there are a lot of cases of people who are ill, so you have to come back, and without any payment after that on extra overtime payment. So those are the conditions which are very disturbing, where we are expecting frontliners to come and provide equality services, while at the end of the day they are not being taken care of.
Over what timeline did you put together this report? Because I should imagine that the situation is even worse.
Actually, the report, we started working on it from last year, but now during the COVID-19, we continue to contact healthcare workers, where we were looking at what are the conditions they are working under. As much as we know in the country that when anything goes wrong, we blame it on the healthcare worker, but when something goes right or when something is right, it's the person who takes the credit is the government. But now we have seen that the healthcare worker, as much as we want the healthcare worker to provide adequate services, but at the end of the day, we can't expect people to do that, because at the end of the day, they are human beings. If they are not treated fairly, then it means that they can't give us quality services.
I should imagine that this has a devastating impact on the nurses and the patients.
Yes, it does, because if you look at what is happening really now in the country, most of the healthcare workers are infected with COVID-19, and we are hearing stories every day where even if some nurses are infected with COVID-19, because of their age or they don't have other illnesses, they are required to continue to go and work. What does that mean? And the patients that are in the hospitals or are going to facilities, at the end of the day, they are infected because of what is really happening. If you are not taking care of a service provider, then the patient won't be able to be taken care of. So we are seeing the high rise of healthcare workers who are infected with COVID-19. Also, patients who are using facilities are infected with COVID-19, because the rotation or the security of healthcare workers, it's not prioritized by our own government.
Yes, I mean, some of them are harassed on so many levels, including sexual harassment, of course. What are you calling for, and how difficult will it be to implement any sort of positive change during this period?
We are calling for a government to take care of our frontliners. These are important service providers in the country, and we have seen how important they are. As much as maybe some over the years we've been saying this, but nobody was taking us seriously. But now it shows, during the COVID-19, it shows that we need more healthcare workers, and we can't allow them to be exploited. We can't allow them to be sexually abused by the authorities just because they need jobs. That is not acceptable, and we cannot tolerate that. So we are calling for a government to have a turnaround strategy in providing quality security for healthcare workers, to make sure that they are taken care of. They need to be provided with respectable salary, so that they can be able to provide quality healthcare services.
The most basic of human rights. Thank you, Sibongile. Tshabalala.
Thank you. Thank you.